So before we get started, we'd love to share our rap song introduction video, and we hope you enjoy.
Yeah, okay, organic base, this is what you need. Take you to the future, live a life that can be disease-free. All these toxins are taxing on our bodies, no doubt. All these GMOs and these processed foods we can live without. Yeah, wanna see you live a long time. Contaminants in our water and our food supply. From the meat to the dairy and the fish, what a shame. Not realizing that my insides were inflamed. Hold up, I know it's hard to digest, that's right. I found an organic plant-based website. I even got the app, yo, this is where it's at. Promoting a healthy life, it's time to put it on the map. Assuaged, trust you don't wanna miss. It's time for you to be your best, be your healthiest. Assuaged, trust you don't wanna miss. It's time for you to be your best, be your healthiest. Hey, Assuaged, let's go.
Welcome. Thank you for joining our PowerPoint presentation today. We have our Director of Media on the line, Dumisani, and a whole lovely group of students. And today we are going to be discussing a public health emergency, exploring chickenpox and monkeypox outbreaks. Thank you for joining us.
Outbreak.
Oh, we just is there a lag?
Yeah.
There's
a lag, and it said that it had disconnected on my side as well. We're gonna edit all this stuff out that we're talking about. But yeah,
Okay.
it said disconnected on my side, and it said it was reconnecting.
Okay. Yeah, no worries. You can go ahead and take it from the top then.
But now it seems like it's reconnected. So
Yay.
yeah. All right. So I'll just go ahead and do the introduction, right?
Yes, and you sound loud and clear.
Okay, that's great news. All right. Hey, everybody. Welcome to another great conversation that we're going to have today from the Assuaged Foundation. And this conversation today is going to be all about public health emergencies. And we're going to be exploring, in particular, chickenpox and the monkeypox outbreaks. This is obviously a conversation that we're going to be having for the Assuaged Foundation and in support of the student team. Now, to make this possible, we obviously have some great contributors and some students who are going to be a part of this discussion. So we do have some student speakers and attendees. I'd like to go ahead and list them here. We have Allison Bifone, who's going to be one of our speakers today. We have Dr. Mahima Patil. We're also joined by Dr. Sana Omer Mian. And we have Aleisha Prentice Michel. We also have Indhira Vadivel, Sophie Sidrac, and we have Bishop Chukwu, who are all joining us as speakers and attendees today. I myself, my name is Dumisani Maraire Jr. I'm one of the board members at Assuaged, and I am also the founder of Love Heals the World. We will be joined as well by Cynthia Cherise Murphy, who's our amazing vice president. She's going to be behind the scenes, making a lot of these graphics and all the magic that you see on screen happen for us. We also have Crystal Rylowicz, our director of Practicums, who's going to be on the line as well, and who's also going to join us later in the discussion. Of course, we have some slide contributors who we couldn't have done this with, including Vivie. We have Kadeza Ahmed. We have Chaymae Hemamouche. I hope I pronounced that correctly. We have Fernando Garcia, and we have Chiao-Yin, Joy Chang, and Carissa Cordero. Chaymae is new to me, so yeah, I'll have to practice saying Chaymae's name a couple times. But we are so grateful to have you all joining us and to all be contributing to this project today and to this discussion. Um, I guess we'd like to say, in Snoop's word, I'd like to say thank you to myself and to lovehealstheworld.club. That's my online arts and humanities club that's dedicated to spreading the divine healing power of love through music, blogs, and fashion. We call our club members healers because they're passionate about spreading the healing power of love. And, you know, hopefully this information can be one way of doing that, the information that we're going to discuss today. So thank you all for joining us. Of course, we also have to give a big shout out and a big thank you to Restream for supporting our student team. Restream's powerful multi-platform streaming capabilities have broadened our reach, connecting us with diverse communities across various social media platforms. Our message of public health and wellness now reaches those who need it the most, all thanks to Restream. So definitely check them out if you're going to be doing any online streaming, anything of that sort. You want to get your word out to the world. Restream has got your back. Today we do have an agenda. And first on our agenda, there's going to be an introduction and overview. And then we're going to have so within that introduction overview, we'll have a brief explanation of monkeypox and its similarities to chickenpox. We have an overview of the current public health emergency. After that, we're going to move into the second phase, which is about quarantining, isolation protocols, and health infrastructure. So we're going to be discussing ensuring proper medical care and support, and capacity building in healthcare facilities and allocation of resources. Third on our agenda, we will be talking about international collaboration, the challenges, and community engagement. So it's all about cooperation with global health organizations, identifying and addressing challenges, and the response efforts. Finally, on the last thing on our agenda, we're going to have a conclusion and student discussion, which is the fun part, where we recap all the key points and lessons learned, and we talk about the next steps and discuss all of the questions. So I hope everyone is ready for a very exciting discussion today. And to go ahead and kick it off for us and to get us started, we have Allison Bifone, who's going to be talking to us about an introduction to monkeypox.
I accidentally put Allison. It's actually Crystal.
All right. So to get us started today, we are going to have Crystal Rylowicz, who's going to be joining us to talk to us about an introduction to monkeypox.
Good evening. Our introduction to monkeypox. The definition of monkeypox is a viral disease caused by the monkeypox virus. It is transmitted primarily to humans from animals such as rodents and monkeys or through contact with infected humans. Symptoms include a fever, headache, muscle aches, and a distinctive rash that often starts on the face and spreads to other parts of the body. Similarities to chickenpox include rash and fever, respiratory transmission, viral origin, vascular lesions, and complications. The current public health emergency includes monkeypox outbreak has been declared a public health emergency in certain regions due to its potential for rapid spread and severity. Public health authorities are implementing measures to contain the outbreak, including surveillance, isolation of infected individuals, and vaccination campaigns. And they are emphasizing the importance of personal hygiene, avoiding contact with sick individuals, and vaccination to prevent transmission. Monkeypox versus chickenpox. Monkeypox is caused by the monkeypox virus. It is transmitted from animals to humans. The incubation period is 3 to 17 days. The rash starts on the face and progresses to vesicles. It can lead to severe complications. Chickenpox is caused by the varicella zoster virus. It is highly contagious via respiratory droplets. The incubation period is 10 to 21 days. The rash starts on the trunk and spreads, and it is mild in healthy children but severe in adults. The importance of an accurate diagnosis includes being crucial for proper management and control measures. Misdiagnosis can lead to inappropriate treatment and spread of infection, and healthcare providers must be knowledgeable about their differences. The monkeypox background. Its origin includes monkeypox being discovered in 1958 among laboratory monkeys in Denmark. The virus recorded in humans in 1970 in the Democratic Republic of the Congo. Its transmission includes direct skin-to-skin contact with monkeypox rash or CABs from an infected person. It also includes contact with objects, fabrics, and surfaces not disinfected after use by a person with monkeypox, and direct close contact with an infected animal, fluids, or waste, or being bitten and scratched. Previous outbreaks in affected regions include historical outbreaks. Monkeypox outbreaks historically concentrated in Central and East Africa, Clade 1, and West Africa, Clade 2 countries. In 2003, 470 cases of monkeypox were reported from 6 states, which include Illinois, Indiana, Kansas, Missouri, Ohio, and Wisconsin. The global impact includes a public health response to outbreaks prompt worldwide public health authorities to effectively enhance surveillance, diagnosis, and response capabilities to manage suspected cases. And it includes the research and vaccine development. Outbreaks stimulate research into epidemiology and prevention strategies, accelerating vaccine and therapeutic development to improve preparedness and control measures.
All right, thank you very much, Crystal. Next, we have Allison, who is just going to talk to us about the current outbreak status.
Thank you. So for current outbreak status, the epidemiological data indicates that 26,384 monkeypox cases were reported in the United States from May 17th to October 6, 2022. 14,133 individuals reported rash. Among 5,017 cases in individuals aged greater than 18 years with reported HIV status, 1,870 were hospitalized and 6 deaths were reported. Geographical spread. Monkeypox outbreak affected regions include Central and West African countries. Affected population. Individuals of all age groups are impacted, with a higher prevalence and observed in areas with close human-animal interaction. Monkeypox cases reported to CDC by race and ethnicity are organized in the table over to the right. So we can see for African Americans, they make up 32.18% of the cases. Hispanic Latinos make up 31.03% of cases. White people make up 29.75 cases. Asian people make up 2.87%, and other race and ethnicities make up 2.1% of cases. Signs and symptoms. This slide is going to show in detail the clinical presentation of monkeypox, starting with exposure from animals to humans or infected humans to other humans. The virus can be transmitted. The signs and symptoms will include headache, muscle aches, fever, fatigue, and rash. The stages of rash and monkeypox start with early vesicles about 3 millimeters in diameter. which will progress to a small pustule, which is 2 millimeters in diameter. Then we progress to bilicated pustule, which is 3 to 6 millimeters in diameter. Then becomes an ulcerated lesion, which will be about 5 millimeters in diameter, before progressing to a mature lesion that is starting to crust over, and then it progresses to a partially removed scab. The diagnosis process is through PCR testing, detection of monkeypox virus, genetic material in patients. And treatment includes vaccination, consider the smallpox vaccine for protection, monitoring, close observation for complications, antiviral medications are considered for severe cases, and then also isolation and infection control. Transmission and prevention. Modes of transmission. Chickenpox and monkeypox spread through respiratory droplets, direct contact with infected skin, and contaminated surfaces. Preventive measures include vaccination. The varicella vaccine prevents chickenpox, while the smallpox vaccine offers partial defense against monkeypox. Good hygiene, including hand washing and avoiding close contact, is essential. Isolating infected individuals and implementing quarantine measures help contain the outbreaks. Chickenpox vaccine is recommended for all ages, administered in 2 doses at specific intervals to reduce severe complications. The smallpox vaccine is not routinely administered but can be utilized during outbreaks or for high-risk individuals like healthcare workers.
All right, thank you very much, Allison. Um, of course, up next we have Dr. Mahima Patil, who's going to be talking to us about the emergency response team.
The Emergency Response Team. Introduction to the Multidisciplinary Response Team. This is a diverse group of professionals coordinating responses to outbreak like chickenpox and monkeypox. It includes public health, epidemiology, infectious diseases, healthcare, labs, government, and community representation experts. The MDRT assesses situations, devises strategies, and implements outbreak control measures. The roles and responsibilities of key stakeholders. The healthcare providers help us with diagnosis, treatment, educating on the prevention, and reporting cases. The public health officials help us with monitoring the data, conducting surveillance, and providing guidance. The laboratory scientists help in conducting the tests, confirming the cases, and sharing the findings. The government officials allocate the resources, implement policies, and communicate with the public. And lastly are the epidemiologists who help with the investigating cases, track transmissions, identify risk factors, and provide data for decision making. Surveillance and early detection. Importance of a robust surveillance system. Timely identification of outbreaks, tracking of disease spread, allocation of resource efficiently, understanding disease patterns. Early detection strategies for effective control. Enhanced monitoring of high-risk population, utilization of diagnostic tools, rapid response protocols in place, and lastly, collaborative efforts among healthcare providers. Public health communication. The role of communication is crisis management. Effective communication is vital during outbreak like chickenpox and monkeypox. Informing about risks, symptoms, and prevention reduces panic and misinformation. Regular updates on cases and control measures build trust. Using diverse channels like social media and community outreach ensures information reaches all. Promptly addressing concerns encourages compliance with health recommendations, easing anxiety. Strategies for disseminating accurate information to the public. You can trust the public health authorities for latest news of outbreaks through official statements, websites, and social media. Work with doctors to teach about disease and how to avoid them. Talk to people in the community to clear up any wrong ideas. Team up with local news for good reporting, interviewing with specialists. Set up phone lines and websites for trustworthy information and questions. Vaccination campaigns. Status of vaccination campaigns. Ongoing vaccination efforts aimed at targeted population. Regular monitoring of campaign progress and coverage rates. Coordinating with healthcare providers to ensure efficient delivery of vaccines. Monkeypox vaccine. CDC recommends Jynneos can be considered for person at high risk for infection to prevent monkeypox. It was approved by the United States Food and Drug Administration, which is the FDA, to prevent smallpox and monkeypox diseases in adults over 18 years of age. Importance of community engagement and outreach, awareness and education. Educate individuals on the importance of vaccination and seeking early medical attention. Second would be encourage participation, encourage community leaders and influencers to promote vaccination campaigns. Third is building trust, establish trust between healthcare providers and the community members. Last is the prevention, implement prevention strategies beyond vaccination campaigns for long term.
Next, we have Dr. Sana Omer Mian, who's going to be talking to us about quarantine and isolation protocols.
Quarantine and isolation protocols. Guidelines for isolation and quarantine. Immediate isolate. Suspected and confirmed cases in the designated area. Utilize airborne isolation rooms when available. Minimize aerosolization activity such as shaking sheets and dry mopping. Provide personal protective equipment to healthcare workers. And quarantine for individuals who have been exposed to virus. Monitor closely for symptom development. Also limit the contact with others during quarantine period. Implement source control by placing mask on patient and covering exposed lesions. The medical care and support includes provide symptomatic treatment to alleviate discomfort, monitor for complications such as bacterial infection, and offer psychological support to individuals who are affected and their families. The preventive measures include promote vaccination to prevent future outbreaks, educate the public on hygiene practices to reduce transmission, and implement contact tracing to identify and isolate potential cases. The healthcare infrastructure. It includes capacity building. According to World Health Organization, capacity building is developing knowledge, skills, commitment, structure, system, and leadership to enable effective health promotion. The capacity building includes strengthening diagnostic capacity at the local level to empower communities to respond effectively to public health events. Investment in diagnostic development and evaluation is essential to address diseases of epidemic potential like monkeypox. The ethical resources allocation include priority groups, identify high-risk groups like individuals who are at the risk of infection, provide fair treatment, treat everyone equally but consider who might get sicker quickly. Levels of importance, be flexible in deciding who gets treated first based on the number of people sick and how much medicine we have. And last is the optimizing implementation. Use active outreach strategies to distribute vaccine to high-risk groups. The international collaboration includes cooperation with global health organization and neighboring countries. It is crucial for combating monkeypox and chickenpox outbreak. World Health Organization framework emphasizes interrupting human and zoonotic transmission, protecting vulnerable groups, and sharing information. Authorities exchange data on confirmed cases, investigate efforts, and provide vaccine guidance. This collaboration ensures a coordinated response to the outbreak, optimizing resources and strategies to contain the spread, safeguard populations, and manage vaccine distribution effectively. Through these measures, global and national health agencies collaborate to mitigate the impact of outbreak and prevent further transmission of viruses.
All right, thank you very much, Dr. Sana. Next up, we have Aleisha, who's going to be talking to us about the challenges in control and containment.
Hello, everyone. So the challenges in control and containment. First, we are identifying and addressing the challenges in the response efforts. Identifying and addressing challenges in response efforts involves tackling issues such as tracing cases to animal contact, incomplete investigations, and timely data access. The other thing is adaptive strategies for evolving situations. Adaptive strategies like rapid contact tracing and ring vaccination are crucial. The image on this slide compares mass vaccination and ring vaccination. This will be found on the left. Rapidly tracing contacts and managing exposures help contain the spread, while ring vaccination targets those in close contact with infected individuals. These approaches enable a flexible response to changing situations, ensuring swift action to control outbreaks and mitigate their impact on public health. Community engagement. The first step is encouraging community involvement in prevention and control measures. Educating communities about the importance of vaccination and hygiene practices is number one. Number two is mobilizing community leaders and influencers to advocate for preventive measures. And number three is establishing community based surveillance systems for early detection. The second one is addressing cultural and social factors. So, number one is recognizing cultural beliefs and practices that may impact disease transmission. Number two is tailoring health messages and interventions to resonate with local norms and customs. Number three is collaborating with community organizations and faith based groups to reach diverse populations. Next up, lessons learned. So, number one, reflecting on lessons from previous outbreaks. First, it's evaluating the effectiveness of response strategies employed during past outbreaks. Number two, we realize that identifying gaps in surveillance and communication in healthcare delivery. And number three, we are learning the successes and challenges in coordinating multi-sectoral responses. And number two, when it comes to applying insights to improve future responses, the first thing up is strengthening surveillance systems to enhance early detection and rapid response. Number two, investing in training and capacity building for healthcare workers and first responders. And number three is enhancing collaboration between public health authorities, healthcare providers, and other stakeholders. Lastly, conclusion and next steps. So, summarizing key points, emphasizing the importance of community and engagement and cultural sensitivity, highlighting the value of lessons learned in shaping future interventions, stressing the need for continued vigilance and preparedness in addressing public health emergencies. And secondly, we have outlining ongoing and future actions to control the outbreak. First, we're implementing targeted vaccination campaigns to reduce transmission. Number two, conducting thorough epidemiological investigations to track the spread of the disease. Providing timely and accurate information to the public to mitigate fear and misinformation. The last one is collaborating with international partners for support and expertise in outbreak management.
All right. Thank you very much. All right. Thank you very much, Aleisha, and thank you to everybody else who contributed and also helped us with reading some of the content that we had before us today here. Of course, we're into the fun part, which is the questions and a discussion with our students. So we have a couple questions here. I'll just go over the first two questions quickly here. So we have question one: Why is effective communication crucial for crisis management in a public health emergency like a monkeypox outbreak? And how can inaccurate information impact the response efforts? I think that's a first great question right there. And the second question that we have also is, what are some critical strategies for disseminating accurate information during a public health crisis? And how can these strategies be adapted to different demographics and cultural contexts? All right. Now, of course, for that first one, effective communication ensures the public receives accurate information about the outbreak, preventive measures, and available resources. Misinformation can lead to panic, mistrust, and ineffective response strategies. So we don't want misinformation, obviously. And for the second one here, how can these strategies be adapted to different demographics and cultural contexts? Strategies including using multiple communication channels such as social media, press releases, and community meetings, collaborating with trusted community leaders, and providing information in various languages. Adaptation involves considering factors like literacy levels, language barriers, and cultural beliefs. All right, so we're going to go ahead and open up those two questions here to our panel of amazing speakers today. There you all are. It's great to see you all. So yeah, we have two questions before us here. Why is effective communication crucial in crisis management in a public health emergency like a monkeypox outbreak? So why is effective communication crucial? Why do you guys think so?
My number one thought is, look what happened with COVID-19.
I think
there was.
It might be muted. I'm not sure.
Oh no, Crystal, go on ahead. I'll come after you.
Okay. My number one example
that comes. I can't hear anything.
Oh, I can hear everyone.
I can hear everyone too.
We're having some delays.
All right.
My audio has gone out.
The number one example that comes to mind is the COVID-19, where they were disseminating information and they were not sharing it globally. And so there was more cause of a panic. And the more information that you're creating, you need to make sure that it's proper so that people understand how to effectively deal with the crisis. Misinformation leads to nothing but higher anxiety, more people doing what they want to do, not following proper instructions. And then before you know, we have a huge pandemic on our hands, which is out of control because there were no established boundaries and guidelines with proper information. So communication definitely needs to be effective so that the public knows exactly what they should do and how to prevent themselves from becoming sick.
To add on to the point of what Crystal was speaking on, another thing that I've noticed when it comes to a lack of effective communication is...
Sorry, I can't hear anything.
Okay.
I can hear.
Yeah, I can hear too. Maybe go ahead, Aleisha, and we'll just kind of roll with it here. We're having some technical mishaps. It happens.
Okay. Okay. So when it comes to a lack of effective communication, one thing that I've noticed, especially in the community, especially in my community, which is college students, we will end up running rampant in terms of the lack of actual information that is that correct information that is actually taken forth. So what will end up happening is one person will hear one thing, another person will hear another, will collaborate, and the wrong information will be spread. And that, like Crystal was saying beforehand, would lead to a lot of fear, a lot of anxiety. And not only that, but another thing too is it will lead to a lot of people harming themselves by accident. You know, too many people will not be able to understand the brevity behind their actions to really understand, okay, let me first make sure that I wash my hands. Let me first make sure that I am careful about the contact that I have between one person through or to another person, and so on and so forth. Because as we have mentioned beforehand, the one of the ways that monkeypox or chickenpox can be um, spread is through the mouth. So if push comes to shove and everybody's having a conversation about this, nobody knows what the actual guidelines are, it can lead to a lot of fear. It can lead to a lot of people accidentally getting themselves mixed in with this, leading to a lot more cases that might have been prevented if the information that was clear and was is correct was making its way through instead of fear mongering and um, a bunch of craziness. So, yes.
Thank you so much. Yes, any kind of outbreak and disease is something we should take seriously, and being able to spread it just as fast, like wildfire. I think all the concepts that you hit on, Aleisha, was and Crystal was very spot on. So thank you for sharing that. Allison, did you want to share anything, my dear?
I mean, you just hit it right on the head with what I was thinking. So I just want to echo back what they were saying, where it's just really important to have that effective communication because it does cause those breakdowns among the general population that leaves everyone at a higher risk of being exposed to something like monkeypox or during COVID times when everyone was figuring out how to uh, keep themselves safe. It took some interesting turns, as we all saw on social media, and so that effective communication really makes a difference in being able to protect everyone properly.
Thank you for sharing that. Dr. Mahima.
Hi. Yeah, so I was just want to say it's sometimes better not to spread any information than spread any information because we tend to add on stuff when we get to know. It's a very basic human nature to improvise whatever you know and then, tell more and then spread more information. So I just feel sometimes you should just wait till the officials actually put down what the protocol is or till we hear it in the news from a proper doctor, then trying to tell our friends or family what to do.
Thank you so much. Yes, and Indhira. Did I say it?
Indra it is. Yeah. So I just wanted to add uh, the I think the social media is not a very good platform to propagate the protocol for uh, what to do during an emergency outbreak because um, as somebody in this meeting mentioned, it unnecessarily causes panic and people don't take everything very serious. So that will not be an effective way of communication during an outbreak. So what I feel is like during an outbreak, I think the the most crowded places and very accessible crowded places are the schools and universities. And if the communication first go to the university and the schools, and if the health officials decide that that should be a quarantine or isolation, or people should not come in contact with each other, I think the right point to start is university and schools. So if the university and schools are if the um, actions are taken from that level, the individual household will really feel okay, something is really serious, and they will just look into the protocol, and they'll take it serious and try to follow, because uh, that's what I'm feeling. So that's my thought.
Thank you so much for sharing. I know we have some feedback here, so we're just rolling through this as technology is technology. So great input and substance to that. Thank you for sharing. Sophie, I see you're here. Did you want to share something? And you might be on mute, my dear.
Okay, can you hear me?
I can.
All right. I just wanted to say I agree with Crystal and Aleisha on what they were saying on how when information is not properly distributed online, like through social media, because everything that's posted on social media is not accurate, honestly. And when information like that reaches college students, that's true. We do tend to over exaggerate or just send the wrong information and then start spreading that around. And then everyone gets into a panic. So I do agree with that. And social media, like I forgot her name, she just went before me, but yeah, when they post information is not always accurate. But I do feel that platforms like the news and stuff, they don't always give everything, give all the information that we should know, and people sometimes have to go through Google to actually, actually search up the information themselves.
I love that. Yes, there's a lot of misinformation in social media. They're getting better at it. In terms of, I see the little flags, there's misinformation. So thank you for sharing all that. Dr. Sana.
Hello, everyone. Just to add to what Sophie said, and Mahima and Crystal, everyone, I agree with all of you. Social media is both is so important now that we cannot survive without it. I know it's like, but it's like a constant information that's bombarding on us from all directions. So again, clear, simple communication, which is understandable and from a reliable source, is what we need to stress on in terms of effective communication. And as Mahima said, it has to come from a doctor or a public health official. Only then we should trust it, and to control the panic, and at the same time not to spread misinformation, which is very commonly done nowadays because everyone has access to social media, and they can say whatever they want to say. So it's everyone's responsibility, not only just the public health authorities or the health professionals, but also as an individual, it's our responsibility to understand if there's an outbreak, we have to just keep ourselves calm, not to spread misinformation, and also try to wait for the clear guidelines for the effective communication to really help prevent the spread, not spread it actually.
Thank you so much for sharing that. I see we have two of Doomney on the screen. He's working through some tech issues. With that said, it looks like everybody on here has contributed to the set of questions. So I can go ahead and move on to the second round. Doomney, if you at any point redeem yourself from the technical issues here, let me know, and I'm happy to give you back to stage. So questions, part 2. So this is going to be the question number 3. And I had some feedback there, so I wanted to pause. Discuss the importance of vaccination campaigns in controlling the spread of infectious diseases like monkeypox. How can community engagement enhance the effectiveness of these campaigns? Vaccination campaigns play a crucial role in building herd immunity and preventing further transmission of the virus. Community engagement can increase vaccine acceptance by addressing concerns, providing education, and involving community members in the planning and implementation of vaccination programs. Question number 4. What are the challenges of implementing quarantine and isolation protocols during a public health emergency? How can healthcare infrastructure support effective quarantine measures? Challenges may include compliance issues, logistical constraints, and ensuring adequate support for isolated individuals. Healthcare infrastructure, such as well equipped isolation facilities and trained healthcare personnel, is essential for providing proper medical care and support to those in quarantine or isolation. So I'm going to go ahead and get us all back on the screen here so we can talk about this. And so, Allison, I would love to hear from you if you're okay to start.
Yeah, I would be happy to start off this conversation for the round of questions. So, I think one thing when it comes to vaccination advocacy and ensuring high vaccination rates, it's really important to emphasize the why behind the vaccine. I feel that communicating that is going to help with rates overall and ensuring that people are fully informed before receiving a vaccination so they know what it's for and then the resources on how to get it and any next steps afterwards.
Thank you so much for sharing, Allison. Crystal, I had not been able to spotlight you due to technical issues on the last questions. Did you want to add to the conversation here, my dear?
Yes, thank you. Regarding question number 3, I think that it is very important to, again, advocate for those advocacies like Allison was saying, because vaccinations are more helpful than they are harmful. And we have research to back that up. Now, am I saying just because a new vaccination comes out, run out and go get it? No. But I am saying that we are not medical professionals and we should be asking questions and we should be looking up research. And above all, there is a certain class that should be protected. Children, number one. Because they cannot protect themselves. Their immune system, especially up until the baby is, 1-2 years old, they have to depend on the adults in the community to protect them. And so if you're an adult and you're just going, well, I don't care, they made this vaccine, I'm just not going to go get it, and you're walking around with something such as the measles that could be preventive, then you should be quarantined because you are doing more harm than you are good to the elderly and little babies that cannot protect themselves. So I really think that we do need to stand up and we do need to advocate more for these vaccine policies. And that sort of piggybacks off from question 4. If there's enough research to back up that you should be getting these vaccinations, and whatever the issue is that you don't want to get it, then I think that you should be mandated to be isolated and quarantined because you don't know when you're going to get sick. And you go out into the world, you're just infecting everybody else who is following the rules and trying to protect themselves. And you're making it worse on everybody who is trying to do the correct thing. When you want to be stubborn for whatever the reason, you don't have the reason. If you want to make yourself sick, that's fine, but you should not be making everybody else in the public sick. And so a lot of people may not agree with me on that, but I think the education is there and we need to advocate that education for vaccines and isolation and quarantine when necessary. So thank you.
Thank you so much for sharing that. And we are running up. We have about 10 more minutes on our presentation here. Does anybody want to add to this discussion? And I'm happy to feature you. We see you, Dumisani. You're working your way back. Aleisha?
Yeah, can you hear me now?
Yes, we can hear
Yeah,
you.
I don't know. I don't know what's going on. Signals in and out. My audio went out, but I'm back, and I heard most of the previous questions and everything. So just want to thank everybody for contributing. um, we're still on question 3 and 4. So were there any other contributions for questions 3 and 4 at all?
Yeah, I wanted to say something.
Mhm.
I just feel when it comes to the third question about what a community can do, I believe in herd immunity. So if there are few people who are willing to get themselves vaccinated, you can always break the chain by getting the herd immunity, because even 7 out of 10 people who get vaccinated can break the chain. So that's really important. And moving to the fourth question, I just feel, because it says what are the challenges of implementing quarantine and isolation protocols, I feel personally, given the situation 2 years ago with pandemic, the most important challenge that we have to tackle in quarantine is actually mental health. Not many people talk about it, but then I just feel when you're quarantined, it's not that easy. And also you cannot come together as a group and talk and everything. So probably if there is a institutional quarantine, then we can have telecommunication or video communication with other people so that they don't feel alone, because feeling mentally well will also help you recover physically faster. So I think that is very important when it comes to the fourth question.
Absolutely. I think the mental health is definitely a very important part of this, of course, and we definitely did see that during the pandemic. I'm not the expert in here. That's that's why I don't feel bad too much that the signal went out on me. If it could go out on anyone, at least it went out on me. Y'all are the experts on this one, so I'm actually here to learn from you guys on this one. Do we have any other? Let's see. Discussing the importance of vaccination campaigns. Do we have any other input towards that? And what challenges of implementing the quarantine and isolation protocols? What are the challenges towards that? If we have any other input, we're all ears.
I have a slight I have a slight amen. I have a slight thing that I want to mention. So one thing that I believe Dr. Mahima was talking about, she mentioned that and I'm taking notes on this, about how there is the herd mentality and how it's very important in making sure that it can encourage others to follow that vaccinations and take those vaccinations, so that it can lessen the amount of people that aren't taking those vaccinations. And I thought it was really interesting because um, the concept of groupthink, it's something that I study from here and there, and it's really interesting how, and this may seem a little bit off topic, but I'm coming back to it. So groupthink, it's basically a herd mentality in which people are collectively all together making and having an idea and sticking to this idea that is widely accepted in a group. And even though a lot of things can be widely accepted in a group, that doesn't mean that it's right. It doesn't mean that it's true. It doesn't mean that it's actually correct or even real. Um, and so we can see that time and time again with different types of I say different types of theories that might be out there in terms of, there was used to be a time in which flat Earth, that we assumed that the Earth was flat, and that was for a very long time in which we assumed that, even though it wasn't necessarily true, even though it wasn't right, a lot of people went to that level, that manner of thinking, because it just made sense at that time. And so I think what is really important here about trying to fight against this group thing, it comes back down to effective communication. It comes back down to advocacy, like Crystal was talking about as well. Advocacy about, vaccination, advocacy about those, and I think also, in general, just a holding people accountable. Holding people accountable not only for their own health, but if they are affecting somebody else's health, holding them accountable for that as well. Um, there are a lot of people that can be, that are immunocompromised or could be potentially immunocompromised just by somebody walking around that's not vaccinated, that doesn't care for vaccinations, and having that level of, hey, you're affecting somebody else, having that, I have putting that out there, letting them know this, and feeling the pressure of groupthink, but this time group thinking going off to the way of vaccination is, I think, really essential, really important. And I think as well, when it comes down to, um, how the healthcare infrastructure can support effective quarantine measures and stuff of that nature, I think just having, I'm not necessarily too well versed in this, but I do think that one of the things that can be taken forth is just a level of understanding of the challenges of people that are, that may have disabilities, physical as well as invisible, as well as invisible disabilities, that can cause them to find different hardships in being quarantined and being isolated. And one of those can be mental health as well. So, yes, that's all I want to say.
Yes. Um, awesome. Thank you very much, Aleisha. Yeah, it's a very interesting topic. Obviously, we all went through the pandemic. We were all there for it. At least all of us on this call, right? So I feel like we all kind of have some sort of experiences with these, and I personally didn't witness anybody die from getting people said that, oh, if you get it, it's worse than not getting it or something like that. I didn't witness anyone who got a vaccine and then was killed from it. Of course, there are all kinds of cases out there of people who say that happened. What do you guys think about that? What should we do in situations like that when there are people who are giving out information like that? It's especially now. I know you've probably touched this a little bit, but maybe if there's someone who can just touch on it briefly, because I know we only have like a couple minutes, maybe 2 or 3 minutes left. But just like with social media and all the stuff that's out there, and it usually hits people before the truth does. How do we handle that?
Dr. Sana, did I see you raising your hand a little bit?
Yes. Yes, thank you. I thought I thought my video paused, but it didn't. Okay, yes, I did raise my hand, and that's a very good question, Dominique. The I feel that how can we avoid this is through education, educate ourselves and educate others, spread the correct information, and I do. This resonates with me too, because many people said, oh, if you get COVID you die, but I didn't actually witness anyone dying from it. But of course there were mortalities, and similarly for monkeypox. But again, we have to understand, for every infection there are some high risk individuals who are at risk, and they need to be identified and they need to be vaccinated, and everyone needs to be aware and to know exactly if they are at risk or not. If there's a child, if someone has immunocompromised system, has cancer, or is severely ill, or is elderly, has diabetes, they are at risk and they need to be vaccinated. Again, for the for advocacy of vaccination, we have to provide resources. We have to make it affordable, accessible for everyone. More vaccination campaigns, which are available in the schools, colleges, so that it's there, and also educate people with effective communication, keeping in mind their cultural values and language barriers, and also counseling, because many people hesitate because they don't know. They hesitate because of their own beliefs, and at the same time, I knew some people didn't isolate or quarantine because they didn't want to be alone. So again, as Dr. Mahima said, keeping in mind providing those resources for their physical, mental health, so that so that the compliance is lack of compliance is tackled, so that can ensure that so that the spread of the outbreak can be controlled, and and endemic doesn't go into a pandemic.
Fantastic. Wow. I think we've gotten a lot of amazing pointers here on how to handle this public health emergency that's been declared, specifically with monkeypox, right? And chickenpox that's happening right now. Um, we just want to go ahead and thank everybody for being a part of this conversation today, of course. It really, really was helpful. And we just want to thank everybody who's been tuned into it as well. If there are any other last questions, anything else, any other last input whatsoever, just want to give anyone any opportunities. All right, I think we're good. Yeah, go ahead.
Yeah, I was just going to say, if you want to know any information, either follow WHO or CDC. That's it, nothing else.
Absolutely, that's important because people need to know where to go to get the good information. All right.
I have one question to Dr. Mahima. Just thinking from a community perspective, like nobody, not every community or every if parts of people who are uneducated or something, they don't know about WHO or CDC. So how we are like, what do you suggest that to tell to that community of people, how to make them follow the protocol? Do you have any suggestion for that?
Oh, that's very interesting. Actually, I never thought about it. I guess you mean like, these small villages and communities, right? Back in India, who don't get
Yes,
access to
back in
CDC.
India or
Right.
African countries, they don't know WHO exists.
Right.
So
So I think for such people, this is where the community comes in role. So I'm pretty sure every village or every town has doctors. They have their public health officials because that is how it works. So probably they can get information from them because at least the doctors and the public health officials or the government from that area are aware about CDC and WHO. And I was about to say news, but then I remember someone saying we cannot really rely on what the news says because they tend to add a lot of stuff in it. So I guess probably your local community leader.
uh, because in COVID, that is what the challenge I have seen myself. Like people are like struggling to find what is a reliable source. Like it may be a COVID outbreak or monkeypox or some or chickenpox, whatever may be the outbreak. People are struggling to those kind of people may be like those kind of uneducated people may be our mothers or grandmothers, we come in close contact with. So they are also have to be like in a understanding zone. But the thing what you said, right, the community leader or the doctor won't have an access during an outbreak situation, right, to everyone. So like how we are going to, if it is not through news or TV, because that I think news channel is very powerful resource, but they have to I think they should work on like only passing reliable information, because even if the doctor is saying, how he cannot just get access to all those people during an outbreak, right? So how he'll reach every house, and like So a news or a TV channel is the only source where a doctor can himself can come and speak, like, okay, this is how you guys have to be. I think that is a powerful resource instead of going for community leader, because they won't have access to everyone, but that information to be passed to everyone is very critical at that point of time. So I think that, maybe if we are making our news channels and things a little more, realistic and reliable, it will definitely help us prevent these kind of outbreaks. um, I think so. That's what I am thinking. What do you think?
Yeah, I think that's another public health challenge that we have to face and advocate and improve.
Right. Thank you.
Absolutely. Fantastic. All right. I don't know. Do we have any other contributions? I don't want to cut it early until everyone's done, but if everyone has their final contributions, I think it's a very important conversation, especially what we've been through in this world the past couple of years. So with that said, I just want to thank everybody for tuning in and everybody for contributing. And, definitely this has been a great presentation brought to you by the Assuaged Foundation. So we want to thank our student team for joining in this public health emergency topic where we discussed chickenpox and monkeypox. Be sure to follow Assuaged app on all social media everywhere. Thank you very much.